Hey, Dr. Maddie Tanucci here from the Carrick Institute, and I want to talk to you for just a couple minutes about a question that we've been getting asked about the functional neurology management of concussion. For those of you that have been following us, you're realizing that level 1 is really about baseline testing, concussion management in the acute phase, and kind of getting the scene prepped for level 2, where we're going to talk about managing persisting concussion symptoms. So people are asking, why should I offer concussion baseline testing if other people are already doing it? Well, here's why. It all starts by understanding what your patients are really telling you. There's what you hear and what they're actually saying. Kind of like the way I am with my wife. I'll ask her something and she'll say, do what you want. And realistically, what she's saying, do what I want. So when your patients come to you and say, fix my concussion, they're not really asking you to fix their concussion. What they're asking you to do is get them back to how they were before or better. Now that's an important statement because how they were before is really important. And if you don't have a baseline, you don't really know how they were before. So it leads you to be kind of lost. If you have no idea where that patient's coming from, you have no idea which direction to go to get them back to normal. And this is where a baseline becomes in really, really handy. However, when we start looking at the effects of a concussion and the subtyping or the phenotypes of concussion, we have about 7 different phenotypes. However, all of the more popular current concussion baseline tests at most assess 3 of those 7 different phenotypes. So what does that mean? If your patient has one of those different phenotypes or different presentations that are not within the 3 that you did in the baseline, you're not going to know where they were before that. So it's important to have a comprehensive baseline, and that's what we talk about in the functional neurology management of concussion. If you have a really good baseline, you can follow that up with an after injury assessment. And if you look at the difference between the baseline and the after injury assessment, it's simple math. You know exactly what happened as a consequence of that concussion. So when you're able to rehabilitate them, you can now say, hey, listen, you're back to baseline or you're better than baseline. It becomes very powerful and patients really become happy when they understand that you're actually reading between the lines, understanding what they mean, and treating what they actually want. So what are some important considerations to have about baseline testing? A good baseline assessment tool must have 4 different things. Sensitivity, it needs to be able to detect something. Specificity, it has to be able to detect what you want it to detect. Reproducibility, you have to be able to do it over and over again, which then breeds intra-examiner reliability. So you need to be able to do something one time and do it again the second time. And if nothing else changed, your outcome should be exactly the same. And those are the things that we try to teach in the functional neurology management of concussion. So if you want to learn more, go ahead and head over to the Carrick Institute's website and log in and register for the functional neurology management of concussion. There's so much more to share, and I can't wait to see you on. Take care, everybody. See you next time.